Good afternoon. We're going to give this a few more minutes just to have a couple more attendees come on in, so bear with us.
To those that are joining, as Emma said, at 12:01, we're going to wait probably at 12:05, a few more minutes to let everyone kind of come in and join. Thank you all for being on time. We appreciate it. Emma and Jill, just so you know, I do have a notepad open, so I'll keep track of any questions and follow-up that we have to do as a result of this.
Thank you.
Thank you.
And again, to those that are just joining now, we'll get started in about 1 minute.
Okay, I'm gonna get it started. So I am Emma, the Director of Marketing and Sales at Forework, and I'm so glad for who can join us today. At Forework, we work closely with home care agencies to simplify compliance and payroll, especially as regulations continue to shift at both the state and the federal level. That's why we're excited to partner with Visiting Aid for today's conversation. Together, we're focused on helping agencies not just keep up with regulatory changes, but also find smarter, tech-driven ways to operate more efficiently. So I'm really pleased to introduce today's speakers from Visiting Aid, industry leaders who bring deep expertise and a passion for solving the day-to-day challenges agencies face. So we first have Jill, co-founder and COO of Visiting Aid, and joining her is Brian, Visiting Aid's Director of Sales and Marketing. They'll be taking the lead on today's sessions, walking you through the latest updates in home care compliance and offering practical ways to navigate change with confidence. So with that, I will hand it over to Jill and Brian.
Emma, thank you so much for that introduction. And again, thank you to everyone that's taken out of the day to join this webinar. We know there's a million things going on in home care, hundreds of fires going on. We're going to make this as value-oriented as possible, and we're very optimistic that you'll come away with at least 2, 3, possibly 5 or 10 things to try to do in your own agency to help your software. Very, very, very quick introduction into Visiting Aid, because this is not necessarily about us, but we are a boutique software firm. We specialize in EHR services, enterprise solutions for home care providers. We operate in 15 different states, New York being our home state. We are a VO. And we are very, very happy to help our providers deal with billing, scheduling, coordination, payers, integrations, etc. That's really enough about me, because you didn't come here to hear who I was or who Jill was. But we're really going to focus on 2 critical things going on in the industry. The biggest one, obviously, is this ripple effect of what's happening with the consumer direct industry, what's going on with the consolidation, what's going on with many new FIs that now have Lixa licenses, what's going on with the regulations, how to manage the conversions. Jill's going to handle that part of the conversation. It's I will never do Jill enough justice to go through what's inside her head, but she's been in this space. And Jill, I'm not going to say the number of years because
Thank you.
you're only 21 years old and the number of years is more than 21, but she's been working with agencies forever. She's the founder of Visiting Aid to allow them to manage compliance. So she's going to go through that piece of it. I'll cover more of the technology strategies. I've now been in the technology vendor space for 10 plus years. Want to go through some of the best practices. One of the things that we know that's also happening with Medicaid spending, with MLTC rates, everyone has to get more efficient, but there's some pitfalls, roadblocks. How do you do it? What do you invest in? And how do you make sure you get a proper return on investment to make it worth the time and energy it takes to implement software? So Jill, I'm going to kind of let you go to talk about, obviously, the three things I just went through, but the consolidation, the rate cuts, and even the EVV utilization requirements that we are seeing in some MLTC contracts.
So thank you so much for that warm welcome, Brian. This meeting is a little bit more for newer operators. So if you've been in this space for a very long time, I hope that you can gain some knowledge from us. So one of the most important things that are happening right now is a lot of our CDPAP operators and a lot of CDPAP operators have obtained Lixa licenses or are starting to use their dormant Lixa licenses. So there's a lot of differences in the regulations and who can become caregivers. And we get a lot of questions about conversions. So a consumer's spouse, parent, or dedicated representative cannot be a PCA. Perhaps a granddaughter, a niece, or a cousin, and we do have links to all of these regs, can be. It's very important first, when you're doing these conversions, to make sure that the certification is done properly. These 8-hour classes are not vetted properly. It's a 40-hour class in a classroom setting to become a PCA. Once you have your caregivers vetted, they have their PCA certificates. When you're a Lixa, you now have to enter them into the Homecare registry. It's very important that everything that's on your software platform and your program that you're using to operate matches what's in the DOH or HCS database. So your date of hire and the Homecare registry should be the same. Your CHRC, criminal history record check submission, should be done on or before hiring. A lot of people have a question: can the caregiver work before their background check comes back? These are internal questions that you need to ask within your own organization. You would have to navigate to your policy and procedure manual. Legally, yes, a caregiver can work before they've been fingerprinted, but that requires supervisions, temporary supervisions. So again, you should always navigate towards your internal policy and procedure. Before we go any further with this, I just cannot stress enough, when you have a licensed home care agency and you are running it and you are the administrator or the CEO, your most important hire is going to be your director of patient services. You need to find a very qualified, very skilled nursing director to make sure that all of these clinical requirements are met on time, that your documentation is on time, that your plan of care that is in your file matches the plan of care and how your caregivers are entering their tasks into your EMR, hopefully Visiting Aid. These are the things that come up on DOH surveys. So a surveyor will come in, pull your files, pull your records out of your EMR for your active caregivers, for your patients, and then start surveying your files. So this is a really critical moment for new operators to have those systems in place to ensure that you're in compliance with all of the DOH regulations, because you do get surveyed. In addition to DOH surveys, you have contractual surveys. You have different types of audits that can come up. If you're Joint Commission accredited, if you're CHAPS accredited, if you can attain those accreditations, it's highly recommended. Best practices for operating. Having a very good EMR that gives you system controls. Everything from how the caregivers clock in and out, how they enter their tasks, how they submit manual timesheets if there's a missed clock in and clock out. It's great to have electronic timesheets options such as we do. We have 4 different types. EVV statistics. Department of Health and OMIG is looking for 90% EVV. At working with operators for all this time, I understand that there are cultural challenges and pushback on EVV. However, if you start on the right foot and you train your caregivers from orientation, how to clock in and clock out, and have that goal for 90% EVV compliance, as long as you're showing a trend of improvement within your first year or two, you should have a very good audit from OMIG, from your contracts, and from the Department of Health.
Jill, can I ask you a quick question on that? How
Yes,
should
please.
agencies track that trend? And any ideas in terms of what to look at, what to monitor? What have you been able to do to help agencies improve the EVV numbers?
Well, we have multiple, in our platform, we have multiple reports. So as an operator, I'm running those reports weekly and monthly to make sure that there's a trend upwards for EVV, identify where the gap is, work with that team member who's in charge of that particular workflow, perhaps a coordinator, perhaps somebody in charge of billing, or a scheduler.
So it's really building into the agency culture, competency, make sure you're always monitoring it, taking a look at EVV. And for those that are below the threshold, continue to train and highlight it and make sure they know it's important.
Yes, and there's a lot of things you can do to encourage with payroll systems, with same-day pay. There's a lot of different perks that you can do to encourage your caregivers to clock in and out. When you have that pushback, we want to try to reward them and keep them up to date with these trends.
And also, just so everyone knows, there will be a time for question answers available at the end. Please feel free to ask questions. We'll dedicate at least 15 minutes to question answer at the end of this conversation. Jill, when we're dealing with the conversions, I know you talked on this a little bit, but what are the key things agencies look at for a consumer that's obviously scared, worried, they don't want to go to PPL, and they come to a marketer for a licensed agency, say, hey, can I work with your agency?
Yes, well, again, there are restrictions with close family members. There are some regulations that we have the link posted to. There are creative ways to get your CDPAP conversions done, hosting a meeting with all your clients, letting people meet each other, exchanging information. Perhaps if you're in a particular culture and you introduce caregivers to other families, you can kind of keep everything in the same loop. There are a lot of different requirements in regards to regulatory concerns for PAs and PCAs. A PA comes in, has 1 service per year on EVV, no license insured. It's a very simple process. For a PCA, they need to be vetted, they need to be trained by a training school and certified. Once they come into your agency, they need to have an in-person or digital orientation. A nurse has to sign off on their file, on their competency evaluation, and acknowledge that they're prepared to take care of the personal care tasks of that individual they're servicing. There's also education requirements. A PCA is required to do 6 hours of in-service per year, as opposed to a PA that had no particular in-service requirements other than EVV. The medicals, the physicals, there are some differences, but that would be based on your policy and procedure internally.
And what we're also seeing and noticing is a lot of the PAs previously, and Jill, correct me if this is your experience, were not necessarily using EVV before. They were doing a lot of timesheets. There's a lot of reluctance to doing it. And any strategies for dealing when you do have a PA that can become a PCA, now all of a sudden doesn't want to do timesheets? What would you say? How would you help manage that situation? What
That's
doesn't
a
want to do EVV, sorry.
That's a very difficult situation. So one of the hiccups is the fact that PAs that lived with the patients were permitted to use timesheets. That was in fact legal. Now they have to clock in and out. And again, it's all about education. And that hopefully starts in the training school before they're certified. I would assume that they have some EVV training in that curriculum. Orientation, bring
And
them
by
in.
assume, Jill says it should almost be mandated, and in the orientation, you should have it. Jill's being nice, but all EVV training should be required.
Yes, and you really have to work with your caregivers, educate them, and empower them. What can we do to make their lives better if they do EVV? Again, there are a lot of options. There's a lot of perks, same day pay, wage parity perks, bonuses, whatever you have to do, because you really need to have your agency at 90% EVV.
Another thing that's critical that Jill mentioned is she always referring back to policies and procedures, right? Because you always make sure you're compliant so everything matches up. There's no discrepancy. We've seen some agencies where consumers are like, oh, I don't want to go to, the entity that I'm being forced to go. I want to go to agency. This other elixir says I could do this. Why can you not do that? And I think it's really important as this shift is happening to understand the risk of putting a consumer as a PCA on elixir that shouldn't be. So, Jill, do you want to talk about maybe some of those risks if an agency is a little bit lax with some of the compliance requirements, just so the people on this call that are new to the Elixir world understand that it's these audits are different than an FI audit.
Well, if you're not abiding by subpart 766, which is really all of the rules of how to run Elixir, if you're not abiding by those rules combined with your policy and procedure manual, you can have very disappointing outcomes on your DOH survey. So it's very easy to abide by the rules. It's not easy to convince your caregivers to do it. However, there are a lot of ramifications if you don't. You'll have contracts come in. A lot of contracts require EVV and will not renew your contract without EVV. OMIG comes in and they audit. OMIG looks at your EVV statistics. DOH is looking at your EVV statistics. So it really comes back to the basics of when you onboard a caregiver. You need to make them feel empowered and motivated to perform EVV. This is the best outcome for your agency.
And obviously, there's going to be some situation, Jill, it's okay to tell the consumer no, right? We can't bring you on. You have to go to this company. Here's the phone number. Like, as much as we want to help people, as much as people are maybe struggling with this, and obviously there's a lot of court cases going on, sometimes you can't fit a square peg into a round hole, as they say.
Correct, Brian. Sometimes you have to just walk away and let them go to another agency or to some other types of service. It is better to protect your license. Everything is under such scrutiny in these days. We don't know what's coming down the pipe from the state, from the governor, and waiver programs are being looked at. So your best practice would be to try to be as 100% compliant as possible.
And here's the beauty of this too, and this is why we'd love to also partner with Foreworks and other companies in the space too. If you don't know what you're doing, if you're new, if you have questions, ask. Obviously, Foreworks has lawyers behind them. They can help with guidance, even if it's not part of their services. Reach out to people. Jill mentioned, obviously, DPS is critical. Make sure the DPS you hire is aware of this. And just to quickly go back to best practices, obviously, make sure you have the controls in place. You're monitoring stuff. You're tracking this. Your quarterly meetings are happening, so you're compliant. And you're sometimes self-reporting when you have to too, right? So if something's off and looks wrong, for the new FI owners at Elixirs, you want to just touch on maybe self-reporting a little bit?
Well, internally, you should have a matrix of reporting tools. You should not be sending caregivers into a home without a plan of care. You should be having the nurse go out within the first 48 hours, if not the first day of the start of care. These are all the things that you should be auditing internally and ensuring that you're onboarding clients in the right manner. If you have an AMR with these kinds of controls, it makes it a lot easier to ensure that you're not sending a caregiver out to a client that has no plan of care, that hasn't been supervised, that isn't monitored correctly. So it's really important to not only self-monitor, but to work with a system that has that flexibility and can also help guide you.
Thank you, Jill. And that covers pretty quickly to some of the technology discussions we're having, right? So again, it's there's so much to talk about when I just go back quickly just to the regulations. We have the links in here. We'll share this slide deck with everyone that's on the webinar and those that can't. The regs are intense, right? Many operators became an FI through CDPAP pretty quickly and pretty easily. If you're new to the space or if you just need a refresher, please look at the regs. There are many, many amazing consultants out there that will come in, help you with mock audits and do stuff. Reach out to individuals as well, talk to your peers, right? So when we talk about technology, right, this isn't just about the shift that's going on right now from the FI consolidation, maybe consumers, maybe new Lixa owners, but it's also the downward pressure we all have with rate adjustments, rate cuts. It's one of the few industries where you cannot really set what you pay a caregiver, and you can't set necessarily what you get paid back from a plan, right? So this is going to continue. This has been continuing for years. The state is going to have budgetary issues around Medicaid. It's a given. Even if nothing else changes, there's more and more people going into the population, and we're going to have to deal with this. So a lot of it's going to be increasing your times of scope, try to improve efficiencies. So we talk to our largest clients as well as our smallest clients to kind of figure out what they're doing. And we want to share some of these strategies with you. I'm hoping a lot of individuals on this call are doing these, but maybe it's a good time to do a little checkup and make sure that technology is at the forethought of your strategic vision and your meetings. So it's really important to have the department heads to always kind of map the workflow. What is it like for a new patient going through the intake process? What is it like for a caregiver going through the application process? How is it for the coordination team? How are they monitoring the visits? Billing team, what's happening on the billing side? From a collection perspective, monitor what you're getting paid, how long it's taking for you to get paid, right? You have to understand the workflow. If this is already not in place, recommend doing it as soon as you can. But identify the things that are causing roadblocks or what's creating the process to slow down. If intake is taking 2 or 3 weeks for a patient to go through the process as quickly as possible, okay, why is that happening? What are the steps? Where is it breaking down? What's preventing the coordination team from getting the 90% of EVV, right? What's preventing the caregivers from clocking in 90% of the time? It's always easy to say, well, oh, it's the caregiver's fault, they have the tools. But do they really have the tools? If you're not at that 90% and you're continually working with caregivers who are complaining, make sure you're listening to those roadblocks, right? Understanding what's preventing you from getting to your goals. Why is it not happening? And we see this all the time. There are so many manual workarounds in technology where people have Excel spreadsheets, where people are doing things in other systems, where because the systems aren't talking to one another, we're downloading a report and manually keying into this other system, right? Look at these systems and understanding what is my team doing, because either one, we don't have the technology in place to manage it, or the technology may not exist, or there's something that our current vendor has to improve to make it easier for us to do our job. Jill talked about like compliance meetings and quarterly meetings. Do this for the technology side too. It's really, really critical. This is your operation. This is what's going to power efficiency as you grow. Can't go backwards, right? So we need to review what our technology goals are. And this comes from the workflow process. What is our strategic objective as an agency? What are we trying to do from an outcome perspective? What are we trying to do from a plan perspective, from a business development perspective? What are we trying to do from a patient perspective, right? Like, how are we trying to improve the lives of our patients? we all know aging is not a sexy thing that happens, right? We all age, we all get older, but what are we doing to make our patients' lives as easy as possible? And how do we use and measure that? That we also go back to our MLTC partners, right? Because, hey, if we're doing more, they should know about it. They should know why your agency is the best. And always do an ROI review of your current vendors. Everyone uses technology to some extent now. There is not a single licensed agency that does everything just with pen and paper. Electronic claims are required, EVVs required. There's a lot of things that have to be done. Are you getting return on investment on your vendors, right? What they sold you, is it being delivered? It's important to always go back to, we all have a sales process, right? And vendors have the same. You have people that are selling you a product, telling you it's going to do X, Y, and Z. Hold them accountable too, right? This industry needs to make sure that they are getting a proper return on investment. And when they're not, you have to, understand those gaps. What's still missing? There's a lot of stuff out there that can improve. AI is doing amazing things. There's integrations, and I'll talk about that in a little bit more. But always, always leverage those vendor partnerships, right? If you have a vendor, they need to be a partner with your agency. You obviously have BAA, business associate agreements, for a reason. The idea behind that is you need to involve them in this process, right? And they need to be responsive, right? This is your business. You're paying these technology companies a lot of money. You need good customer service, and you need to make sure that the things that are preventing you, the roadblocks that are happening, the gaps that you have, the things that are causing caregivers not to hit EVV, for you possibly to use contracts, the things that are causing patients that are discharged from a hospital not to get services right away, or what's causing your patients not to have the, the touch points they need, or the clinical compliance visits. Like, you have to go back to your vendors after these quarterly meetings. One, they should be initiating these quarterly meetings, right? But if they're not, initiate it with them. Go to your client success rep, go to whoever they are, like, hey, we need to meet, we have these issues, we need you to help us solve them. And there's gonna be times where they can't, but you have to have that conversation with your partners, because you're not just sending them money to do the day-to-day, you need to have them help you with what you're gonna need in the future. And that's gonna be higher efficiency, better solutions, and better outcomes. Now, what's really, really critical here, and this is probably the part which I've seen a lot of pain throughout my career. Again, I've been doing this for 10 plus years. I've done it through various companies in this space. So I see the pitfalls. I also know of the horror stories that happen with implementations, right? How things have cost agencies hundreds of thousands of dollars because, it didn't go the way it should go. So what's really, really important is, obviously, you're doing these quarterly meetings, you're identifying the gaps that you have, you're talking to your vendors, your partners, about what they have, and you should be demoing the areas that you have identified in these meetings, quality improvements, just like you do in other areas of the company, right? Okay, I need a demo. I need to see what's out there. I don't have to actively be shopping, but if I have a gap relating to patient intake, if I have a gap related to EVV, I need to understand what strategies are out there, what AI may be out there, what other things are out there that could help out. But here's what's always difficult in this industry, because again, there are all these fires. You're going to find these areas where, oh my God, we're doing all these things manual. The system may not be working as it should, or we're not getting the return on investment that was promised. I tell this to Jill all the time. We're going to go as fast as possible, as slow as possible, right? So everything is urgent, but you can't go too fast. You have to take time, go slow. As you're going through a demo, avoid the yes trap, right? So we all had these sales calls or demos where, can you do this? Yes. Can you do that? Yes. Can you do this? Yes. And you're getting yes, 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 but you're not seeing anything. It's really, really critical that you slow down the process to make sure whoever's trying to sell you is also showing you. The last thing, listening to the concerns. And when you have these quarterly meetings, there's going to be things you identify that are use cases. We have this issue. It's really, really critical that you have them show you how that issue is done. It's not just a, yes, this is how it's done. They talk you through the process. It's important that as you're doing demos, again, you're going to go as fast as possible, as slow as possible. Slow down. Avoid the salesperson that tells you yes, 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 because you know they have a financial incentive in selling you. They may not have a financial incentive in keeping you. And it's really important for you to see that that happens. Make them go through the specific use cases. Have an issue with live-ins. Have an issue maybe where there's sometimes another caregiver that comes in. How do I handle billing? How do I handle this issue, right? Because you're identifying all these roadblocks, all these gaps as you're having your quarterly meetings, as you're routinely mapping this out. And you're going to find that, okay, am I getting the return on investment? Do I need another software? But before you implement and before you go down that process, one, make sure they show you what you need to see. Two, highly critical, involve the people that are going to use the technology. I've seen this step skip too many times where the person using it, the person that's going to have to deal with it, is not involved in the process at all. They get to the implementation part and they said, I can't use this. Why? I didn't cover this, right? So what we try to do and what we tell every agency to do, don't speed through the demo process. Make them show you what you need to see, not just yes you to death. And make sure the person that is going to be involved with implementing and using technology is part of that process. It gives you the buy-in, but it also makes sure that nothing is missed, right? I have a specific use case for this. I'm forgetting about the other 90% that maybe the other system does well. I need to make sure the person that does it day-to-day is involved and understands that process. I left a couple things off this, which I realize now, but I want to cover this. Interoperability is key. I think about our everyday lives, how much we have on our phones, how much we interact with our banks on the phones, how things talk to one another, right? How do we move things? How much manual entry are we doing, but how much is the systems doing it automatically, right? So it's really, really critical to have interoperability in home care. It's probably the area that we see, and clients that we talk to love that we do it, but needs to be continually improved, right? So every clearinghouse has the ability to connect to them. It's through an SFTP connection. Your vendors should be connecting to clearinghouses. Billing data should be automatically being sent, and payments should automatically come into the system. There should be zero gap between bills going out and payments coming in through e-billing. Every clearinghouse could integrate and interoperable. One, when you speak to your vendor, make sure they're doing that. The second thing is, which a lot of people don't really do too much, but the home care industry needs to be connected to the care continuum, right? The home care for years, and still is, almost exists outside of it, right? Communications with the hospital networks aren't happening. There is a beautiful program, there's beautiful ability through the HIEs or the health information exchanges, through the RIOs, the regional health information organizations, where you can get from the hospital system discharge, hospitalization. You can also build it into your nursing practices where the patient signs off, so you can get additional details back. We think it is critical, and we think this is almost a must-have for anyone in the home care industry in order to get the efficiency that you're going to need to be able to operate on Medicaid margins, maybe reduce standard things, is you have to maximize the interaction with the care continuum and know what's going on with your patients. Third-party integrations. Right? No software is going to do everything, right? Even us, like I say, we do as much as we can, but no software is going to do everything. Period, right? There's going to be people out there that do stuff better. If you try to be the best at everything, you're going to be mediocre at everything, right? So you look with other systems. Everyone has, whether it be Foreworks as payroll, right? Whether it be someone on the in-service system, right? Whether it be an intake module, whether it be whatever the case may be, these need to be connected, and they can be. Now, some of it's with the API, which is automatic in real time. Some of it is with file transfer overnight. But these are things that you should be identifying in your workflows in terms of what's slowing it down. Are my clinical visits not happening on time because it doesn't connect with the system that my clinicians are using in the field? We have to do it manual. I hate the word manual. I know it has to happen sometimes, but when I see a million Excel spreadsheets tracking compliance, I always think of what Jill tells me. That's a compliance disaster. Because if the system doesn't have the controls in there, there is absolutely no way to guarantee that when that auditor comes, you're going to have a nightmare on your hands. Now, these things take time. I don't want anyone to think, okay, I'm going to call my current provider now. Best case scenario, they say, okay, they'll work on it, but hold them accountable. If they are giving you a promise that they're going to do it, or they're going to look into it, right? These people are part of the industry. They profit off of your business. It needs to be a partnership. You need to make sure you get the good customer service, and you really need to make sure that they are working with you to achieve your goals and not preventing or creating these roadblocks to get in the way. The other thing I didn't have in here, Jill, which I was thinking about, which is really, really critical, is you need to own your data.
Yes.
And this is really, really important. And I think most agencies don't do this. And it's not necessarily too complicated to do, but your data's in the cloud. But what happens if the vendor you have goes out of business? So what happens if you want to change vendors? What happens in all these situations? Data duplication is almost a must-have now for a couple of reasons. One, you can run your own business intelligence off of that data. I know we have it built in, Jill, but not all systems have data intelligence. You also need to own your own data. So if you need to port your data, move your data, do other things. So there are a lot of data aggregators out there. There are a lot of companies out there, whether it be Tableau or Microsoft Power BI, that have the ability to do data replication overnight or in real time. I know we use Power BI, Jill, but there's all these systems out there. You need to have your data, own your data, and understand your data. Because that way you're never held hostage by a underperforming partner. You have your data if you're ever audited, and you don't have to worry about someone's server, quote unquote, going down, right? And being down for hours. And it's really critical to do all 3 or 4 of these things, right? So just to quickly recap, identify the workflow by department. A lot of people have stuff in their head, but once they start writing it down, they realize things are missing. Know what the roadblocks are, what's preventing you from being done more efficiently. Review any Excel documents that you have. Why is it in Excel? Why is it being done manually? Quarterly meetings, almost mandatory. Every one of our top agencies that are excelling and we see their growth meets quarterly to talk about technology. I hear a lot of ping. Joe, we get any questions or no? I don't see any yet. We're about to get to the Q&A section in a bit anyway. Know your gaps. And if you have any vendor that's helping you with your business, maximize that partnership. Workflow quarterly meetings, involve them. Make sure you get the return on investment that was promised. Hold them accountable because you need them to be a partner in the industry. Otherwise, it's going to be very, very difficult to move forward as the state puts more pressure on the rates, as plans put more pressure on compliance, and EVV is being built into contracts. That's our spiel, right? We've talked now for 35 plus minutes. Emma, thank you again for the platform. We really want to open this up. Again, a lot of this was the new Lixers, people have FIs coming over, but at the same time, establishing Lixers using technologies, you really have to have a technology strategy and hold your vendors accountable and make sure we are always improving together as an industry.
And it's really important to have the right technology partner. The technology should have encompass almost everything you need to operate under one platform. And these are things that we focus on quite a bit with Visiting Aid, in addition to compliance and billing and everything else. Less add-ons and more usable features.
Jill, one quick question for you. What type of documentation do you recommend for a consumer that's now becoming under a licensed agency? I mean, I know you covered you follow your agency's policies and procedures. So if you would, because again, you've wore this hat many times, you're now onboarding a consumer that's now switched to a licensed agency with the proper PCA caregiver. Are there any other things you want to re-highlight or make sure an agency knows? And again, this is probably more for the newer Lixers, that they need to have a checklist or something that they need to make sure they do, and obviously have it built into a system.
Well, it's very important to onboard your clients correctly, have your documentation. And when you're touching on that, I don't think there's any regs for discharging CDPAP patients. I think it's discharge to PPL, discharge to another vendor, discharge to Alexa. But I would highly recommending documenting everything that occurred and having in their file, whether it's a digital file or a physical file, the documentation of when the services ended, where the client is going, whether it's PPL, Alexa, or another type of services. I think that documentation in the end can be very useful.
Jill, we did an amazing job. There's no more questions. So again, for those maybe that aren't familiar with Zoom as much, I'm sure they are. There's a question and answer
I have it
portion.
open. I'm ready for a
I do
question.
too. There's nothing that's really coming other than that one for you, Jill. Emma, nope, no for Emma, but just a huge shout out to Foreworks just because we have many clients. Again, we were about 50-50 with CDPAP licensed agencies. A lot of the FIs do not exactly know what they're doing. The great thing about Amina and Forework and Emma and her team is you have the ability to ask legal questions. And these questions are, I think, going to be critical for a lot of operators to ask those questions now, as opposed to waiting till you have an audit and you're asking your lawyer to prepare a corrective action, or asking your lawyer, okay, what do I do now while you are losing revenue? So be as proactive as possible, which I know is very difficult in an industry that remains under intense pressure. We obviously appreciate everyone joining here. I don't see any more questions coming in.
Oh, we got something.
Will require training such as sexual asset infection control.
These would be part of the education portion for your Alexa. You will have those types of in-services, and infection control is an annual required in-service. Sexual harassment, that's something that is required by the Department of Labor.
One of
So
the things I
please,
also recommend for obviously individuals to ask those questions, right? Because you're new. I mentioned before demo often. There are companies that specialize in service. While we have the controls in our system, what's required, there is a little, reach out to one of those companies that specialize in service as well. Get knowledge from them. I know, Jill, you do a lot of consulting on that with our current clients and collaboration. But as Jill mentioned, those are required. There are more. Do you want to elaborate any more on that question that came in?
I was typing back to the person who
Oh,
asked.
yeah. Okay.
So yes, I mean, we get our regulations, we get 766.11 from DOH, we know what's required, but then you also have to look into, again, in your internal policies. It's very important to make sure that all matches up.
I got a question about clearinghouse integration, Jill. I don't know if you saw it, but
No,
well, it was asked, and again, I'm not going too much into providers have choice. You can use any system you want to use. Some payers have clearinghouses that they require or prefer, right? Some payers switched from Inovalon to Availity recently, so we now integrate, obviously, on those claims with Availity. All clearinghouses have the ability to SFTP connections, which we connect automatically, so payment details come in automatically. And I guess the elephant in the room, you do not have to use HHA Exchange as your provider solution, right? So for those link payers that come in, we do connect with those payers as well. They use HA Exchange as a clearinghouse. We integrate with them. Other systems can integrate with them as well, right? So it's still provider choice. I know people have been burned on that before, but you have the ability to choose the system you want. I'm not going to talk too much about this. Isn't a visiting a demo. We're more than happy to show you how that works. Again, everything on these demos, you don't want someone saying yes. We're going to show you the integration with the clearinghouses. For providers, whether it be a CHA contract or MLTC contract, have the ability to use whatever system of record they want. That system of record just has to connect to the payer, which we do, through HA Exchange payer product. I just want to, I know there's a lot of convoluted around that. So if there's a question, again, please reach out to us. We're more than happy to go as slow as possible through the demo process, because we're not in a rush to do this, but we want to make sure that you also see how it works and have the confidence.
And I just had a question about the regs for caregivers. So
The family member restriction.
yes, that's DOH 18 NYCRR 50514. I sent it in the internal chat here. And you can call visiting aid. I'm happy to give some information if you're interested. Your payroll company, of course, if you're working with someone like Forework, you have your consulting built in, and all of your partners should be able to guide you.
I'll just read some. Payment for personal care services shall not be made by patient's spouse, son, son-in-law, daughter, daughter-in-law. And I think it also includes grandchildren too, right, Jill? I'm not as familiar with the regs as you are.
No, I think there's so many. This is the only reg that I found in time for this meeting that I could actually locate.
Yeah,
I'm
we
not
have the
sure
regs.
about the granddaughter.
We'll add this reg to our link of
I think we did.
not in yet, the regulations. So that will be included in the PowerPoint. Please make sure you check that out. So because again, it's going to be this conversion and the consumers don't know what to do. Make sure you know the regs. If you don't, ask questions. We'll include the reg in the PowerPoint, so you have a link to go and read through what the state is saying on the topics. All right, Jill, that was definitely a power lunch. I don't see anything else going on. Emma, anything you want to? Oh, as soon as I say that, there's another thing that comes in. Oh, thank you. That's the easiest question. You're welcome is the answer. Thank you for that. Emma, anything you want to add? I know you've been an amazing host and kind of let us kind of go through this, but I do want to give you, you know, the ability to say anything if you want, or obviously wish everyone a great day.
No, of course. Thank you guys so much for doing the presentation for us today. I would like to just say to the attendees who did attend today's webinar, if anyone is interested in learning more about Forework, we are a partner of Visiting Aid. We have a long relationship with them. We would be more than interested to speak with you if you have any questions. So you can give us a phone call, an email, and I'll be right there to communicate with you in regards to anything. But other than that, thank you guys so much for the presentation. It means a lot.
And thank you, Emma, for inviting us to be part of your team at Forework. We love helping our clients achieve their compliance goals together. And we look forward to hearing back from some of the people who have joined our webinar today.
Of course. Alrighty, guys. Thank you guys so much for joining.
One last thing, just to make sure, you know, we will add in the link for the who's allowed to deliver services to this page of the PowerPoint slides. I know we answered, but it will be added. This will be sent out to all participants. You'll have the contact details for Forework, Emma and her team, as well as myself and the Visiting Aid team. Please feel free to reach out. We're more than happy to show you and let you know what we're doing to help agencies deal with the challenges. So thank you again, everyone. We appreciate your time today.
Thank you. Look forward to hearing from you all.
Thank you. Have a good day.
All right.